Thank you, Mr. President, members of the board, Dr. Swanson. It is my pleasure to be here today to talk with you about mental health services available here at Westminster Public Schools. Obviously, it's a very timely topic. As we discussed, Dr. Swanson talked about the brush fires. That's really hit close to home with many of our staff members, but also more globally with the pandemic that we're all experiencing, climate change, political discourse in our country, you name it. There's a lot of things going on in this country that's affecting all of us in some way or one form or another. So it's good to talk with you about some of those things today. I will start by saying that it is really difficult to talk about mental health in isolation of everything else that's going on. It's mental health, as we all know, it's not just something that's on an island or can be addressed in a vacuum. It's really kind of needs to be integrated fully within the fabric of an organization. So that's really my purpose here today, is to talk with you about what that sort of organizational DNA is like in our district with regard to mental health. So let's start first with the challenges that we are experiencing. This is not a laundry list of all the challenges that are going on, but these are some of the things that we as a society and as our kids are dealing with. I don't really need to say much more about the pandemic other than the fact that it's impacted everyone. And it could range from having to wear these things to all the rules that are associated with the pandemic, with masks and social distancing, vaccinations. Obviously, it's causing a lot of stress for a lot of people, to not being able to socialize as we used to, of course, pre-pandemic, to losing a job or losing a loved one in many cases. And so there's a lot of things, obviously, that are happening that's impacting our mental health collectively from the pandemic. Also, Gen Z generation, which is our youth really today in our schools, they're dealing and seeing and exposed to violence and sex than any other generation that has preceded it. I'm in Generation X, and so access to violence and those types of things were hard to access. Right now, it's a click of a button on their cell phones at any time during the day if it's not being controlled by their parents, and so that is partially contributing to some of the issues that we are seeing today. We do see some increases over the last 10 years. When I say 10 years, that's the 2009 to 2019 data from the CDC At-Risk Youth Report, that persistent feelings of anxiety, sadness, and hopelessness appear to be on the rise, and that seems to be a pretty straight line at this point in time. And so those things, sadness and hopelessness, are associated with depression. And so when we read and hear a lot about that increasing as well, anxiety and depression, it's coming from those types of issues. We're also seeing an increase in the numbers of students that are choosing not to go to school because of safety concerns, either real or perceived safety concerns in their school. Hate crimes continue to rise. That's been rising over the last several years, and that continues to do so, even more so this year, in the last couple of years. And then among our most at-risk population, our LGBTQ youth are most at risk in terms of being susceptible to being bullied, having anxiety, depression, suicidal ideation, attempts, and actual deaths by suicide as well. So those are some of the challenges, but not all news is bad news. There are some encouraging data that are out there, especially over the last 10 years. One, especially recently, over the last year and a half, we're seeing that deaths by suicide for youth are flat and declining. That's after about 10 to 15 years of increases of deaths by suicide. At least the last year and a half, we're seeing that they're flat and declining. We don't know if that's just a glitch in the data, whether that's just due to the pandemic, higher suicide attempts, but lower deaths by suicide. But we're seeing that trend, which is sort of an interesting trend. Also, over the last 10 years, the percent of youth that has ever had sex is declining. It's a good thing for under the age of 18. For those that are, the percent that are using birth control is increasing. You combine those things, and we're also seeing a significant decrease in teen pregnancies over the last 10 years. Also, dating violence among female youth is decreasing rather significantly, and that was even happening before the Me Too movement. Obviously, that's helping a tremendous amount in terms of bringing about an awareness for our young ladies and men as well. But dating violence is decreasing. as is the use of illicit drugs or injected drugs, is decreasing among our youth over the last 10 years. I know it sounds surprising, but the data are really suggesting that over the last 10 years. Okay, the next one. So why is mental health so important? What we do know is mental health, I should say poor mental health, is associated with a lot of things that we don't like to see in societies. Underemployment, STDs, unhealthy relationships in some cases, drug and alcohol abuse, you name it. A lot of those things are associated together. And so societies that address those issues collectively are better societies, quite frankly. And there are a lot of societies inside the United States as well as outside the United States that have a pretty good handle on addressing those exact types of issues. Sadly, I think overall in the U.S., we're kind of behind the eight ball in terms of mental health, seeing that as something that we take seriously. Although I think most recently, if there's one good thing that's come out of the pandemic, is that we've become more aware of mental health and its importance for our youth especially, and for everyone. And so that's good. We're starting to see increased resources, certainly from Governor Polis and others putting money into addressing mental health in the state of Colorado. The challenge, of course, is finding people to meet the demand, which continues to be a challenge there. But I think that's a step in the right direction. Our goal in this district specifically is to help make mental health part of the, as I mentioned, the organizational DNA within the district. And I think if we're able to do that, then we're going to be quite successful. So these are the things that we're doing at this point in time to help make that more of a fabric of who we are as a district. Starting, here's a graphic here, but starting at the 12 o'clock, I just want to give you an idea of what mental health services we have available collectively in this district. Starting at the top, mental health interventionists and school counselors. So mental health interventionists are largely school psychologists and school social workers. In addition to school counselors, we have at least one in each of our buildings, K-12, and in some cases, especially once you get into the secondary level, we have multiple folks in there, either mental health interventionists or school counselors. So we have a full array. I can say that a lot of districts do not have that available. It's not uncommon, for example, that a school psychologist is sharing 2, 3, or 4 schools in a building. That's not the case with our school district. If you go to the right, we also partner with the Community Reach Center, who offers school-based therapists. And so we have a great partnership with them. Their role as school-based therapists is to provide more the Tier 3, we call them our trauma-impacted students, kids that are really impacted from a therapeutic perspective. They may be referred to any one of these school-based therapists within the district. And we have 8 FTE of these SPTs, or school-based therapists, in their building. We've had that program around for about 6 or 7 years, and it's been incredibly successful. We also have a day treatment within our school district. That's pretty unusual for a district our size. We call it the Instructional Services Center. It does enroll anywhere between 20 and 25 students that have real significant emotional disabilities per their IEP, as well as have some violent tendencies. And so it's a highly structured academic and therapeutic environment for them. It's not a place that they're in for their entire academic career. In fact, in most cases, these students are in that building for maybe a year or less before they're ready, once they've met their goals, to be gradually matriculated back to their home schools, only when they're ready and they have a really good process and successful process for that. The next is professional mental health consultation. There's no mental health interventionist in our district that feels like they're on an island, meaning that if they have a really difficult case, they can contact any array of people, myself included, Melissa Sandoval, Leslie Rodell, Heidi Weekly, to get into some real more of the difficult issues. And there's probably not a day that goes by that any one of us isn't consulting with one of our team of individuals talking about a difficult case. We also have a partnership with Elevation Ability Services. They offer what are called Board Certified Behavior Analysts. These are BCBAs, and these are the folks that you would call in for in some cases, some of the more extreme cases. We've budgeted, $5,000 each of the last few years. This year, we're tripling that budget, thanks to Sandy Neese. Thank you, Sandy. just because of the need is increased this year. More than any other year we've had. We're going to pilot another program. We're always looking at expanding. How do we expand our services? Because we can't be a one-size-fits-all. We have to always continue to look forward. So we're working with the Community Reach Center again to look at a peer support program. These are non-therapists. These are people who've gone through similarly as students on any given topic and are there for support. They're highly vetted and they're certified. They take classes, and it's a program that CRC, the Community Reach Center, has had for the last 10 years, and they want to pilot that in our school district. So we're glad we have them. The next one and the last one there, I just kind of fit it in there. I'd be remiss to talk about what we're doing in terms of helping support staff in Westminster Public Schools. Of course, they can see Kaiser, they can go to the Community Reach, but as part of their benefits program, as you know, they have an employee assistance program which allows them 5 sessions of therapeutic services for free. So that's part of that. I kind of want to put parentheses because I know in the middle we're talking about students, but I also wanted to talk about how we're also addressing some of those needs for our staff. So this slide's mostly for the students that are watching, who may be wondering, how do I get services? How do I get help? It's really that simple. You go to someone. You can go to a teacher, a school counselor, mental health interventionist, someone for the office, and just tell them you need to speak with someone, and they'll take it from there. And that's as simple as that. You don't have to get into any details with that teacher. You don't have to tell them why. Just say, I need to see someone, and they will get you help, and they do a really good job of doing that. A couple other things that I included in this slide is that for students 12 and older, parent consent for mental health services is not required, okay, under HB 191120. That's new. It used to be 15 or older, but as of that bill passing, it's 12 and over. But we still encourage the consent to happen with the parents. We always default to getting consent from parents, whatever the age. But it's just an FYI in terms of how we provide those services for kids that need it, regardless. And then, of course, professionals network with others internally or externally if needed. For example, if they're working with a student who is also homeless, then you can guarantee they'd be on the phone with Jamie Scaroni from Homeless Division to discuss resources available to that student and the family. So it's a very interconnected network going on, and that's just one of many examples. Next. I've mentioned some of the community resources. Of course, the Community Reach Center is on top. They are probably our biggest partner and most valuable partner that we have with regard to mental health. Not only do they provide outpatient, but they also provide crisis response as well. If we have a crisis in the district, those are the people that I contact to provide any additional therapeutic. Rather than taking our mental health professionals off the floor to help support a crisis over here, we keep them in their buildings. We contact Community Reach to help support. And they provide anywhere between 1 and 5 therapists, depending on how big the crisis is within the district. So we're well supported. I won't go over each one of those, but you kind of see the other resources we have available. The only last thing I wanted to mention is that last bullet on that page, which is iMatter Colorado. That's probably the most recent initiative. In fact, Steve Saunders wrote in What's Up, WPS, a little segment on iMatter. Basically allows 3 free sessions for any student that needs it just by calling that number. So that's one of the resources we have available as well. I wanted to talk also about crisis reporting and response, because you may have questions on that. And so we have a number of different assessments that are conducted by mental health interventionists and school counselors mostly. Threat assessments, child abuse, neglect reports, that can be done by anyone because we're all mandated reporters. Gaggle alerts. Gaggle alerts are basically if we have a student that's emailing, let's say a peer, and expressing some sort of suicidal ideation, for example, or I want to die, well, that gets flagged and sent to TIG. And then TIG takes action. And what he often does is to contact the principal, maybe the mental health interventionist, so that child can get help. Somebody can reach out to him or her and provide whatever support he or she needs. It's not a disciplinary issue, it is a complete support issue. So gaggle alerts are really valuable. So all suicide assessments come to me. And so once I get them, that I track them, log them, and I share them with Dr. Swanson on a monthly basis, and Dr. Granum as well. Suicide assessments by the numbers. As of today, we have 80 suicide assessments that have been submitted. That is elevated from the past 2 years. We're probably around 60 to 65 around this time, the last 2 years, but 80 is pretty high. Again, not too surprising. It follows the national trend in that regard. But out of the 64 students requiring follow-up, so 16 did not require follow-up just because they were incredibly mild cases. 4 of them, or 6%, have shown no or minimal improvement. 24, or 38%, have made moderate improvements, and 36, or over half, 56%, have made significant improvements based on the mental health that they're receiving from these suicide assessments. So really, we're talking about 94% of students whose suicide assessments were submitted to our team, mental health, had either seen moderate or significant improvements. So really good news. Our mental health folks are our unsung heroes because all this stuff is happening behind the scenes. As you can well imagine, highly confidential information. It's not something that's out there, but I wanted to make sure that I acknowledge them and the hard work that they do. Out of those 80 suicide assessments, three students had repeat suicide assessments, only 3. And then, of course, the most important number is that last bullet, 0 deaths by suicide this year. Next, I wanted to kind of give you an idea of what a moderate improvement sample or significant improvement sample would look like. Obviously, I took away the names, but I just cut and paste what I saw on our suicide log and pasted it here. So I'll just give you a few seconds to read what that looks like. So you see the difference there, but you also see that these are, again, highly recorded. We've been doing this for the last 8 years, so we have 8 years of great data. And if for students that aren't showing those improvements, we continue with the follow-ups, we try new plans, new ideas, new guidance, until we get to the point where we're feeling comfortable that the student's ready to, no longer needing the follow-up. Okay. I thought, kind of switching gears a little bit, I think a lot of people ask the question, as you know, we have a new department called the SEL, Social Emotional Learning Department, that's led by Melissa Sandoval. And so I think there's a lot of questions in terms of, well, how does SEL interplay with mental health? And they actually interplay rather nicely. They're not the same thing, so they're not synonymous, but they do fall on the same continuum. And so this is something that Melissa put together that I thought did a really nice job of kind of describing SEL as it corresponds to mental health. SEL is on the left-hand side. Of course, it starts with the very far left brick there, which gets into building-wide supports, culture, and climate. That's probably the most important thing if we're going to help support the overall mental health of students, is to ensure that all of our schools, all of our classrooms are supportive and have a real positive culture and climate. And we know that many of our schools, in fact, most of our schools certainly have that. Focusing on adult SEL, because it's not just working with kids in isolation on their social and emotional learning, but also helping with the adults, providing classroom embedded support, but also providing direct SEL support. That might come from a school counselor or a mental health interventionist. As you get further to the right, now we're talking about group individual support and maybe trauma-informed mental health support. So now we're getting to the more mental healthy things that are done typically by our mental health interventionists and our school-based therapists. But you can see that on the far left, where it says all are therapeutic helpers. And so on occasion, not often, but sometimes we have a teacher says, well, I don't do that. I'm not a mental health interventionist. Well, that's true. They're not mental health interventionists, but they are therapeutic helpers. And everyone in the building, everyone in our organization is a therapeutic helper in some way. So since we're all therapeutic helpers, including those who are watching us today, and that could be teachers, it could be parents, it could be students or other community members, we're all part of the solution. So I thought it'd be kind of a good idea to kind of put down some things that are really based in research that we all can do as therapeutic helpers. So next one. First, the late Dr. Abraham Maslow in the hierarchy of needs, he was right. Basic needs like food and shelter must be met first before anything else. Of course, we do a really good job with this in Dr. Duffy's office in terms of providing food, support for families that need, especially during the most difficult times of the pandemic. Clothing banks, food banks, things like that. All those things that we talk about that you all support as board members are helping meet those basic needs, which must happen first. Next. This just say hello, that's probably one of the easiest, smallest interventions we each can do. A lot of the kids that are feeling withdrawn, don't feel like they belong, they don't feel maybe respected, are the ones pulling away the most. These are the ones that are having probably the most significant mental health related issues. And so just walking down the hall, just saying hello to every kid that you see. And if everyone did that, boy, we would really see some differences there with that very simple intervention. That has an impact. Having a trusted, well-connected adult or support system in one's life helps all children thrive. And so after a suicide assessment, one of the first things I talk about is, do we have a safety plan? And does this kid have a connection to a peer, adult, or a support system? If not, develop that support system. And so those are the things that they work with the student about. They don't impose on the child, but they work with that student on putting together a support system for that child in case times get really tough. Next. Empower students to think critically, make healthy choices, bounce back and learn from failure. That is Sir Carol Dweck's type of work. To have agency, that's a big value of ours at Westminster Public Schools, to have student agency, to empower and make decisions, because if you can make decisions on the small ones now, as they become more complex, you can make the right choices down the road. Assist youth to navigate through complex emotions, leave no child behind. Basically means if a child is expressing something of interest, it could be disclosing something to you. Sometimes the response is, you'll get over it. Sleep on, or whatever. Be there, listen, support. Even if you don't have anything wise to say, it's okay. So long as you're there for them is important. Of course, being models, showing decency, respect, dignity, kindness with others, even when disagreements occur, because kids are watching us at all times. If we as parents or as educators aren't doing a lot of these things that we're recommending, then of course they're going to follow suit in many regards. So that's what we're trying to do consistently. Listen more, talk less. That's probably the hardest thing for me to do. I think if you were to ask my son, I'm an advice giver, and so he'd probably want me to kind of shut up a little bit more and listen. But absolutely true. Listen. Again, you don't have to have all the wise words. Sometimes it's just sitting there, listening, and being there for him or her, whatever the need. Establishing clear, fair, and consistent boundaries. This is for teachers and for parents. It improves, not diminishes relationships. Sometimes we think if we have boundaries, if we don't have a bedtime, if we don't have a dinner time, those types of things, that our kid's going to hate me or not like me, and that's not true. It's the opposite. It improves relationships. It establishes predictability. They know, again, establishes the sense of right and wrong, helps develop moral compass. Those types of things at a young age help so that as they get older, those things become easier. Spend more intentional time. I think very supported in the research that, it's a quality time sort of issue. And the research says it doesn't have to be hours. We're talking 15 minutes. And again, when we have some of our students expressing suicide, saying that I feel like I'm invisible in my family. They're not talking with me. I don't know. Nobody likes me. That's oftentimes the recommendation we give to them, to their parent, having a conversation. Spend some time. I don't have time. 15 minutes, 5 minutes. Start somewhere and go from there. That little bit will make a huge difference for that kid. And they'll find that they're having fun once that happens, and that probably encourages more time spent with their children in that regard. And then finally, the last thing, we are a person-brain school district, and so we are trained. In fact, Melissa and Heidi Weekly are both trained as trainers. They've trained a lot of people on our person-brain model that we've used the last 3 years, and it's really helping ensure that all people, not just students but staff, feel safe, significant, respected, and related. and it helps everyone flourish. Those are the 4 elements of flourishing. And so it's a model particularly used for trauma care, but it really works, of course, for everyone. If everyone feels that, and we're making concerted efforts to address that for every single one of our staff and for our students, then we will go a long way in terms of addressing some of these issues that we're talking about. And that's all I have today. I just wanted to leave this in case anybody's watching, maybe somebody who may be feeling suicidal or maybe knows of someone who's having some of those thoughts. They can call that number, the hotline, or they can text home to that number as well and get the help that they need immediately. So any questions you have?
Any questions, Ward?
No, sir.
Well, Dr. Sandoval, that was an excellent presentation. Thank you very much. I was thinking throughout your presentation, how far we've come in 9 years, how far, and then even in the last part of your presentation, how far we've really come in the last 3 or 4 years. And we're not where we want to be yet, but my gosh, we've made great strides in the school district in how we deal with mental health and how we deal with students and adults who need it so badly in our district. So thank you very much
Thank you.
for the program and what you are doing, what we are doing to really help especially all of our kids.
And I guess I do have a question. So Dr. Sandoval, how do you see this growing? Like, what do you need in the future as we go? Because you can see the growth and the support that we're giving. I know you mentioned we're going to need more, and I agree.
Well, I'm of the opinion that, first of all, you all are, as board members, as superintendent, our leadership, we've been very generous with the amount and type of mental health support and partnerships that were allowed in this district. If I were to believe any of my colleagues around the metro region, they'd say that we're certainly the envy in the metro region when it comes to mental health. We can double our mental health and we would still have concerns and issues because, mental health is not going to fix everything, as we know. Many kids are coming from some very, very difficult situations that schools just cannot fix through a mental health provider, school counselor, whatever that may be. So I think probably first and foremost what's most important is the work that not only we're doing here with what I discussed, but also the high reliability schools piece. HRS 1 is about developing safe and collaborative environments. And I think that if we're able to do that systemically in every single one of our buildings and classrooms, that would be really conducive to real healthy networking, healthy relationships, addressing problems when they occur. I think that's going to be one of the sort of biggest pieces we can do to help support. Now it's just a matter of now addressing these other layers as they occur. Mm-hmm. But you all have been incredibly supportive, and I'm incredibly grateful for that.